Okay, so the sterile gloves in the pack are compromised and not working. So for the purposes of demonstration, we're going to assume these gloves are sterile. We've already in previous skills established how to put on sterile gloves, so I'm not concerned with that, all right? But what you would do, you would put on the non-dominant hand first. Then you would take the gloved hand and put on the dominant hand, all right? So with that in mind, we're going to glove up with non-sterile gloves because the one in the kit does not fit. In a clinical setting, you would probably want to get a separate set of sterile gloves that you know are going to fit. We're going to discard these. Okay, so the next point, the next part of our procedure, we're going to take our equipment tray. The catheter's down there. Remember, we're not going to compromise any sterility or cross over a sterile field. All right, so what we're going to do, we have 5 cc's of saline. We have a lubricant for the catheter to go through. And we have our iodine and a septic. What we're going to do is, right now, we're going to put our iodine in the tray. Remember, the tray is sterile. All right? There we go. Iodine's very messy. It's sterile. And I'm not going to use the lubricant, but I'm going to open it and fill it up right here. There we go. All right. And we have a specimen cup if we would have to take a urine specimen. All right. So, I'm going to prepare the catheter now. I'm going to take the catheter. Remember, my hands are sterile. I'm going to keep this part sterile. All right? All right. Now, at this point, I'm going to go to the patient's perineum. Now, it's very important that I take through the drape, take my non-dominant hand for a female, and I'm going to spread the labia. Okay? When I touch the skin of the labia, this hand is no longer sterile. I cannot move it until I'm done. All right? With the sterile hand, I'm going to take the iodine swabs, and I'm going to swipe one swipe on the skin. The outside, put it down. Grab a new swab. The inside, the left side, put it down, grab a new swab. I'm going to swab and cleanse the meatus. All right? Never letting go with this. Now, before I go to stick the catheter in, I would have checked the balloon, all right, to make sure it inflated properly. There it is. Okay? So with my sterile hand, I'm going to lube the tip while I'm holding, and I'm going to begin to run the catheter through the meatus about 2 to 3 inches through the urethra until I see urine flow into the tube. Okay? When I see urine flow in the tube, I'm going to go a ½ inch higher to make sure I'm up. Okay? And not just barely in the bladder, but up. And once I'm where I need to be, I'm going to inject the saline. going to inflate the balloon in place. All right?
Wow.
And that's what's going to hold it in the bladder.
Okay.
Now, by this time, this will be in because you need two hands. Because as soon as I let go of this, it's going to come back in. So I need two hands. I'm going to undo that, and the balloon stays inflated.
Wow.
When I go to pull it out, I'm just going to allow, which is another skill, but I would aspirate all of the saline out of the balloon, and then it would come back out.
Wow.
All right? So, after it's in there, I'm going to make sure urine is flowing on this bag. I'm going to either hang this on the bottom of the rail or tape it to the client's leg, whichever is more accessible. Now, if the patient were a male, the variation would be I would have to take the shaft and lift it straight up, and then I would swab the glands. All right? If he's circumcised, that's fine. If he's not, I have to pull the foreskin back and swab in a circular motion. One complete circle, another swab, another complete circle, another swab until it's all cleansed. And then I would insert it through that way. I would have to go a little bit more because there was more to get through than with the female, but everything else would be the same. I'm going to discard my supplies appropriately and document the procedure. Make sure he's comfortable or she's comfortable and has everything that she needs. Thank you.